for just a few minutes, let's just look at the lungs. This is the right lung and this is the left lung. As an obvious feature, notice that the cardiac notch is on the left side. On the right side, there is an upper, a middle, and a lower lobe. Notice that separating the upper and the middle lobe, there is a transverse fissure. There is an oblique fissure separating the middle from the lower. Interestingly, in the cat, there are 4 lobes on the right and 3 on the left, as compared to the human, which has 2 on the left. There is an upper lobe. There is an upper lobe on the left, and there is an oblique fissure on the left, and then there is a lower lobe. Upper, lower, upper, middle, lower. Transverse, oblique. When we pull these apart, the indented area along this medial aspect is what do we say this indented area is called? Everybody said hilar region? Hilum, okay. Same thing on this other side. This is the hilar region of the left side. And what is this prominent notch right here in the left upper lobe? That's the cardiac notch, right? That's where the heart sits. Let's look at a few more things that we might can see here. Easily can see the thyroid cartilage right here. And there's the trachea back in there. There are rings that help support the breathing tube so that it doesn't collapse when you breathe in and out rather heavily. There are bronchioles. The place where the trachea splits is called the carina. These are called the primary bronchi, and then when they split, again, secondary, tertiary bronchi, and then we go down to the level of the alveoli through little bronchioles and alveolar ducts. That's not really viewed here because those are microscopic structures. The muscle that separates the thoracic cavity from the abdominal cavity is called what? This is called the diaphragm, the muscular diaphragm. Also notice that it's a little bit higher on the right than it is on the left. That's because the liver is pushing up. On an x-ray, you'll see the gas bubble in the stomach on the left side. That's kind of one way you can tell left from right if you don't have a marker on your film. Another comment that I would like to make is that this is the thyroid, or the Adam's apple here, but the one right under it is the cricoid cartilage, which is really not easily seen in this picture, but it should be lying right under this area. In the back are the corniculates and the arytenoid cartilages. You can't see those well in this picture right here.